Tepezza is a prescription medicine used to treat TED, no matter if you've had TED for months or years. Tepezza may cause infusion reactions. Tell your doctor right away if you have high blood pressure, fast heartbeat, redness of the face or feeling hot, difficulty breathing, headache, or muscle pain. Please stay tuned for additional important safety information later in this video.
I've been really pleased with the impact that Tepezza's had. I'm really glad that we started that conversation and we were able to do a treatment. I am Saleemah Fahmi. I'm a clinical endocrinologist.
My name is Lamary and I am a professor at a local community college, and I'm also a full-time teacher at a high school. In 2022, I first met Dr. Fahmi. Back in 2021, I had just finished having my third child. We had noticed, or more specifically, my husband had noticed that my left eye was protruding or bulging more than the right.
Going back to when Lamary initially presented and kind of the steps that we went through with diagnosing her thyroid eye disease, I noted the asymmetry in her eyes. She didn't really have anything illustrating that, yes, her eyes are very different than her normal presentation. And so as we talked about the symptoms, talked about the thyroid eye symptoms from visit number 1 to visit number 2 to visit number 3, but her thyroid eye symptoms actually got worse and progressed. When I make the clinical decision that I do want to pursue treatment with Tepezza with a patient and with Lamary, I explain about the disease process and about what's happening, about the idea that thyroid eye disease is an autoimmune disease. It is, the immune system attacking the eye and the tissues behind the eye. Thyroid eye disease can manifest itself with the bulging. Patients can get diplopia because those eyes are not moving conjugately. And in Lamary's situation, I could see the need to treat her thyroid eye disease. So we did discuss the risk, and we talked about them to the point that she was comfortable with the risk because I saw the potential for the benefit when we used Tepezza.
Initially, I would feel fatigue. Then there would be like a slight amount of nausea when I was first doing the treatment.
Once Lamary began treatment and once she completed all 8 of her treatment infusions with Tepezza, I saw that the symmetry of her eyes over time just continued to improve and improve and improve. The most prominent symptoms were in her left eye, and the main thing was that the left eye, there was much more significant proptosis in her left eye over the right. And over time, the eyes just became, that left eye just began to settle more and more and more and become symmetric with that right eye.
Post-treatment, my eyes improved. That really meant a lot to me. I chose to continue on with the treatment because it really did help. Being able to walk around and not have to hide half of your face with your hair or having to wear shades or sunglasses all the time just to cover up that one eye is protruding more than the other.
It's important with Tepezza that patients get all 8 infusions. Tepezza is a series of infusions, 8 infusions in total every 3 weeks. And so you want to make sure that patients are comfortable and that they actually get the entire treatment so that they can really get the full benefit of Tepezza. If someone's not bringing up their eyes, but when I'm having that exam, I'm noticing that they're shifting their head or they're turning a certain way to look at me, then that's going to be my window to ask those questions. Are you having issues with your eyes? Are you uncomfortable? Typically, if someone has any degree of thyroid eye disease, there's going to be something on exam. It may be subtle. It may be something as subtle as the way that they turn their head. There's going to be windows. And once that window is open, then as providers, it's really our duty to just come on through that window and begin to start the conversation about thyroid eye disease so that we can really get a sense of how burdensome it is and decide if a patient warrants treatment.
Over the course of this journey, what I learned about myself is that the smallest things that I took for granted are actually very big for me. I've been told all my life, you have pretty eyes, your eye color is so pretty, your face is so, proportioned, your skin is so nice, and so on and so on. over the years, I've realized I'd taken that for granted. And after being diagnosed with thyroid eye disease and seeing that effect on my eye, I came to realize that you have to stop taking the small things for granted because they're very big for you. After completing all the treatments, I'm much better today. Post-treatment, I noticed that my eyes were getting closer to the way that they used to look before being diagnosed with thyroid eye disease.
She was one of my initial patients who I diagnosed with thyroid eye disease and went through this whole treatment journey. So just being able to really have the opportunity to treat her and to see the impact that Tepezza had, and really just being able to see her treatment journey and her after treatment journey with thyroid eye disease and with Tepezza, this is what motivates me when I see another patient that's suffering, and maybe even suffering in silence, maybe not even complaining about thyroid eye disease, thinking that this is something that's normal.
Important safety information. What is the most important information I should know about Tepezza? Infusion reactions can happen during or within 24 hours after your infusion of Tepezza. If you have a reaction while receiving Tepezza, your doctor or nurse will slow or stop your infusion and treat your reaction. If you have a severe infusion reaction, your doctor may stop your treatment completely. Tell your doctor or nurse right away if you have any of these symptoms during or after your treatment with Tepezza. High blood pressure, difficulty breathing, fast heartbeat, headache, redness of the face, feeling hot, muscle pain. Tepezza may worsen inflammatory bowel disease, IBD, such as Crohn's disease or ulcerative colitis, even if you don't have a diagnosis of IBD before starting Tepezza treatment. Tell your doctor right away if you have worsening IBD symptoms, which may include diarrhea with stomach pain or cramps, blood in your stools, sudden urgency to have a bowel movement, or feeling like you need to have a bowel movement even when there's little or no stool to pass. Tepezza may cause an increase in your blood sugar. Before starting treatment with Tepezza, tell your doctor if you are currently being treated for diabetes, know your blood sugar is high, or have been diagnosed with diabetes. It is important for you to take your treatments and follow an appropriate diet for glucose control as prescribed by your doctor. Tepezza may cause severe hearing problems, including hearing loss, which in some cases may be permanent. Tell your doctor if you have any signs or symptoms of hearing problems or changes in hearing. Before receiving Tepezza, tell your doctor if you have inflammatory bowel disease, Crohn's disease or ulcerative colitis, are currently being treated for diabetes, have been diagnosed with diabetes, or know your blood sugar is high, are pregnant or plan to become pregnant. Tepezza may harm your unborn baby. Tell your doctor if you become pregnant or suspect you are pregnant during treatment with Tepezza. Women who are able to become pregnant should use an effective form of birth control, contraception, prior to starting treatment, during treatment, and for at least 6 months after the final dose of Tepezza. Are breastfeeding or plan to breastfeed? It is not known if Tepezza passes into your breast milk. Talk to your doctor about the best ways to feed your baby during treatment with Tepezza. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, dietary, and herbal supplements. Know the medicines you take. Keep a list of them to show your doctor and pharmacist when you get a new medicine. What are the possible side effects of Tepezza? The most common side effects of Tepezza include muscle cramps or spasms, nausea, hair loss, diarrhea, feeling tired, high blood sugar, hearing problems, taste changes, headache, dry skin, ear discomfort, weight loss, nail problems, and changes in menstruation. This is not a complete list of all possible side effects. Tell your doctor or treatment team about any side effect you may have. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/safety/medwatch or call 1-800-FDA-1088. Please see full prescribing information or visit Tepezza.com for more information. Talk to your doctor to see if Tepezza could be right for you.